Hello, everybody. It's Russ Curtis, professor of counseling. Thank you for joining me today. Thank you for all you open-minded folks who are helping the world evolve and being on the cutting edge of behavior therapy here. Counselfying is a term I heard a couple years ago, and I really liked it because I think the best counselors know how to apply the essence of a lot of different theories. And then this way, they're not just running down kind of a narrow understanding of each client. They can apply a broad array of concepts and skills and techniques depending on what the client wants, what they value. And it's so just very important to be flexible in order to work with clients well. So I wanted to just kind of talk about some basics of some of these theories, and I'm going to be going into more detail with other videos, and you may have seen that when I'm talking about the essence of different theories. But some of the basics to keep in mind, like for instance with psychodynamics, sometimes called psychoanalytic, or probably more commonly called psychoanalytic, psychodynamics a more modern term, is just that the unconscious is real, that we have an unconscious that affects our thoughts, feelings, and behaviors that we are largely out of touch with. The purpose of that therapy, whether it's through dream analysis or the analysis of transference that happens, is to bring that unconscious material to consciousness so that we can discuss it, process it, know it for what it is, not be scared of it. And then that changes the dynamic of the power structure between id, ego, and superego. It balances out the psychic energy of those structures. All right. Parts work, of course, well, that's just what I was talking about, the id, ego, superego. Or if you want to apply Burns' transactional model with that, it'd be parent, adult, child. Okay, Adlerian, just the essence of this is the power of social connection, that we are social beings. We're motivated by being social, not necessarily that everything is unconscious. Okay, and also early memories. I love early memories. Asking clients about their early memories, talking about it, because we can learn so much about how they view the world today based on some of these early memories. And a psychosocial history. How many times are you doing intakes and psychosocial histories? I really credit that to Adlerian therapy. And ultimately what that is being curious about the person, being curious about where they were raised, what was their family like, who did they most identify with, legal history, medical history, all that stuff. Okay, existential is all about the power of the relationship. And it's about immediacy. It's about asking clients, hey, how's this going for you and I right here? Because if we can talk assertively and openly about our professional relationship, then you're going to be able to do that easier outside the world with your bosses and kids and so forth like that. And then that creates better relationships, which then overall helps your well-being. Asking the big questions with existential. Who are you? What are you here for? What do you really value? Just all those big questions. Now, PCMI, that's person-centered and motivational interviewing. I know this will be controversial, but I really think motivational interviewing is just a structured person-centered therapy. But what we're talking about here with both of them is unconditional positive regard. Collaborating with clients. We're equals working together to solve problems. Okay, this isn't a hierarchical thing. The equality of their relationship, maybe using decisional balance sheets with clients to help them look at pros and cons and just consider their decisions a little bit more thoroughly. Gestalt is all about the power of the body language. So whether you call it somatic therapy or whatever, is recognizing the power of the body to speak. CBT, to increase compassion towards self. Hey, really think about the thoughts that you're having about yourself. And is that accurate? Can you be a little kinder? Can you soften those core beliefs up a bit? Behavioral therapy, social modeling is one. Being professional, showing up on time, having a clean office, being assertive, not aggressive or passive. We're modeling to folks, how to be in the world. Course reinforcement, and also having clients envision their goals. Okay, let's talk about that. We don't necessarily even have to act on them, but let's start thinking about where we want to be. There's a lot of theories we could bring in with that one. Last, for this one, and we'll talk more later, reality therapy. I love the fact that one of the key features, and I don't think it's emphasized enough with reality therapy, is you never give up on the client. You're the person in the client's life, regardless of what's going on, regardless of how bad a mistake may be or whatever, you're the one who never gives up. So the power of the relationship is everything in reality therapy. And I sometimes think that gets missed when you read the theory. So we empower clients because we're saying, hey, you're the expert of you. You make your decisions. You make your own value judgments about your behavior and what you're doing. I'm going to be here. I will certainly help help us look at all angles, but I trust your power to make decisions. Okay. And it's also asking, hey, what's the need beneath this behavior? Okay. You think about the 5 basic skills there. I'm not going to go into all of those. I use the acronym peanut butter French fries, but the power and all that survival and so forth is, all right, you just acted in this way. What do you think the need was beneath that behavior? All right, got my dog barking in the background. I hope this is helpful. It's just a summary of kind of the essence of some of the theories. Again, the best counselors know their theories so they can be more flexible with clients. All right, good people. Talk to you on the next video. Take good care.